India doesn't support sex selection because there is lot of mindset in India to have a male child.
A little about sex selection. I mean, this is PNDT in India is a big thing. You are a big proponent, of following this PNDT Act, and you have established many systems, across centers all over India. I think you are, the legal person for almost 250 plus doctors all over India. So a little about PNDT, and we have couples coming in saying we want family balancing, we want to have a male child. So please enlighten our viewers about this act
I
and
think
what is right
I
and
will
wrong.
have to give some bad news for that India doesn't support sex selection because there is lot of mindset in India to have a male child, and that ultimately resulted in decline in a female birth rate, and it is not a good for the society to have imbalance. To bring it into proper balance, AR PCPNDT Act was enacted in late 90s, right, and it is strictly followed. The punishment for not following the law was 3 years of imprisonment. And interestingly, those who are doing sex selections, those doctors, the punishment for them is 3 years of imprisonment. But for patient, it is 3 years and 50,000 fine just for asking for it. For doctor, when they do sex selection, they are liable under the law. For patient, for asking for sex selection, there is a 3 years of imprisonment under section 23/3 of the PCPNDT Act. Only thing is nobody is complaining against them, but not knowing the law is not a defense. I cannot murder someone and say that I did not know the law.
Right.
When you ask, you become liable under the law because you are seeking sex selection. And for seeking sex selection, the punishment is 3 years of imprisonment for the patient. And that is under PCPNDT when the girl is already pregnant. Under ART Act, they have said the punishment is up to 8 years of imprisonment for sex selection in ART. It is more, and they have said this law is not in derogation of the PCPNDT. It is in addition to PCPNDT. That means you will face the punishment under PNDT as well as under this.
Right.
So I request all of them not to ask for sex selection. So asking for sex selection itself is a crime for the patient.
Yes.
And they should not ask for it. They should not seek it.
And I think in present times, a girl and a boy are.
Doesn't make any difference.
It doesn't make a difference. There is equality of gender, which is talked about in our country.
Yes.
And I think we respect India's stand on, preventing sex selection and giving equal importance to the female gender in our country. This is a way
Yes.
of protecting the female gender in our country.
Right.
Right. And a little about genetic testing on the embryo, whether it is allowed and when is it allowed. So pre-implantation genetic testing. And the other question is for number of embryos which can be transferred. Is there a legislation about the number of embryos which are transferred?
Right. So as far as genetic testing is concerned, genetic testing can be done on the embryos, but not for sex selection purpose. The entire page in the law is written for this particular thing. You can do genetic testing for known, hereditary, or any there is history, age of the couple is more, even donor cases. You can go for genetic testing just to check whether embryos are euploid embryos, aneuploid embryos, or any genetic existing disease they have running in the family. They have some index child with this disease, and you can go ahead and do it for all scientific reasons, not for sex selection purpose. That is the only thing. So never ask for sex selection through genetic testing. That is the thing.
And also in our country, the genetic labs doing the genetic testing for indicated patients, it very strictly they mention there that they will not reveal the sex chromosomes of the child
unless there is
a
sex-linked
sex-linked disease.
If there is sex-linked disease,
which
they
has to be
naturally,
proven.
yes, they have to be proven, and then they definitely they can disclose the sex, but it has to be a sex-linked disease.
Right. And what about number of embryos transferred?
Number of embryos, the law says you have to transfer 1 as far as possible, 2 in case of indicated patient, and 3 when there is maximum 3, not more than 3. For 3 you should have very strong indication to transfer.
Right. So I think, Dr. Hitesh, we've covered everything to do with
and
the
it is
ART
couple's
law.
right to choose how many children they want in one go.
Right.
If couple says that I want only one child, you can't transfer 2 embryos.
Right.
If they get twinning out of some natural twinning of the embryo or natural part, this thing of the embryo, that is fine. But you can't transfer 2 when they want only one more child. So you have to put this information before the patient, let them decide, and it is their call how many children they want. Right.
And what about foreign nationals? We have so many foreign nationals. Okay, surrogacy now we know is banned for foreign nationals, but foreign nationals coming and seeking ART, IUI, IVF treatments in our country, what is the take home for them when they come to this country?